Good morning. It's Friday, May 24th, so it must be time for another update from your North Carolina Medical Society. Well, it's been a bit of a light week this week. The House was pretty quiet. We're still awaiting that Senate budget process to start, which we think will happen next week. So along our long weekend, we're thinking that the Senate will release their budget either late Monday night or Tuesday. So we'll be full-fledged in that process next week, but we're closely monitoring that process to make sure that no policy changes that we don't like are in that bill, and if they are, that we can amend those changes through the budget process. Remember that the House has already released their budget, so this is the Senate side, and then of course after the Senate goes through theirs, we'll go through a conference report process. So this is the second kind of step in the budget decision making process and seeing what our budget will look like in this biennium. So a few bills moved this week. One that I want to point out to you, House Bill 388, immunizing pharmacists. And while the title could be a little bit misleading, this bill just allows pharmacists to increase the number of vaccines they can give to 3 additional vaccines that the pediatricians, the family physicians, and us, along with the independent pharmacists, worked out a compromise with these 3 vaccines. So this bill met crossover in the House and is now moving through the Senate process quite easily. And the next bill I want to point out to you is House Bill 70, and this is delay NC Health Connects for a number of different groups and entities, but the most important entity that relates to our members is the psychiatrists. So this delays HIE connection for them, which they've been asking for, but there's a whole list of about 9 or 10 other different groups that are also exempted within this process. But also this week, the bill was amended within the committee to allow the NCDHHS secretary or her designee to exempt certain providers or groups or entities based on the criteria of the provider retiring or an inadequate network. And there are a few other areas in which DHHS could exempt a provider or a group of providers if they're unable to connect to those services or have access to broadband. So that's something that we'll continue watching as the bill moves forward through the process. One other bill that I want to point out to you that moved this week is the co-op broadband bill. This is one of, I think, about a handful, 3 or 4 of broadband bills that we've been watching, specifically because you all have asked us to follow these because you want to have telemedicine access in your communities and in your practice. So followed this one closely. It moved through without very many questions, but we'll continue to follow that and update you on the status of that bill. Also for White Coat Wednesday this week, we were thrilled to have Dr. Lacey Hobgood from Internal Medicine to visit us along with a resident and a medical student, both from Brody. It was great to have them in the building. We also had Quincy Jones, who is a PA at Duke and a provider at Trosa. And we were excited to have her as a part of the Leadership College program. And she also brought a PA student from Duke with her, and we were thrilled to have her as well. Now, don't forget, we're slowly wrapping up session here, hopefully, and we know that legislators will be in the building for about the next month. So if you haven't registered yet for White Coat Wednesday and you want to, or you want to be Doctor of the Day or PA of the Day, about a month-ish left that we know of in order to do that. So make sure that you're putting that on your calendar and letting us know when you'll be visiting us. Well, I hope you have a great holiday weekend, and we look forward to updating you on the Senate budget next week.